He was so unpliable to his basic dream.
He just didn't think you should have to beg to help poor people. He thought that that just was a given, that poor people just ought to have, they had a right to good health services.
He was mission-driven and vision-driven. And so he kept that before us, that don't forget, we're here to take care of the underserved.
You know, most of the time I've heard the story tell, and people make it sound like just one day Dr. Rodgers woke up and said, think of making have a health center, you know, and it didn't quite happen like that. The thing that he was first noted for in Kansas City was suing the state of Missouri.
At the time that he came to Kansas City, there were 2 public hospitals. General number 1 for whites, general number 2 for blacks.
There was no hospital that black people go to other than General Hospital. And when he and his group of residents, they came together to do their residency there at the hospital, the conditions were so bad that they sued the state of Missouri. And I think that suit went on for about 10 years.
Even though he was African American and of course had a heart and a concern for African Americans, he just cared about people. He was 50 years old when he left his practice, went back and got his master's in public health. He was already taking care of poor people. He had a practice with colleagues, and he was taking care of people who probably otherwise would not have had it. But I think he got to the point where he figured that in order to take care of more people, he had to do something different. He had to be at a different level.
He could see that much of the health care was complicated by the conditions around them. So when we opened up, we had a social worker, we had transportation people, and all of that was not accidental. It was because if you put a pharmacy and you don't allow them to get to the medicine, then it becomes ludicrous, or at least hard to understand. Why would you even let them come to see a doctor? So that set the tone for a major social change in this community and in the nation. And I always say that Dr. Rodgers was so understated because everybody thought he was a physician, but really he was the social change artist that allowed us to make everything a bit fairer.
He talked about the care of others. They're the people who need, they're the people I want to care about. It was just inspiring to me to see that love. This person would come home with a stack of records, and as he touched each piece of paper, he was touching a life.